Hello, my name's Tom Powles. I'm a medical oncologist from London. I've been asked to talk about the 9ER study, which is a 650 patient trial in first-line metastatic clear cell renal cancer comparing Nivolumab and Cabozantinib. Cabozantinib at 40 milligrams with Sunitinib. It's very similar to the design of other studies in the frontline setting, which have used Sunitinib as a control arm. The trial was positive for PFS, which was the primary endpoint, with a really impressive hazard ratio of 0.51. It went on to show overall survival, which was significant at 0.60. It also showed really impressive response data in the mid-50%. The overall efficacy data, as it stands, are very much in line with what we've seen for Axitinib and Pembrolizumab. Remember, the Axi-Pembro data started with a hazard ratio for survival of 0.53, and more recently, the more robust analysis with longer follow-up. And it's important to remember that the Cabo-Nivo does have longer follow-up, so it's in a similar ballpark to Axi-Pembro, and that more recent data with Axi-Pembro is 0.68. Overall, I can see more similarities than differences from an efficacy perspective. I think that it's clear that the VEGF-TKI immune checkpoint inhibitor combinations, the two positive ones, because remember, Axitinib and Nivolumab and Bevacizumab and Atezolizumab have not yet achieved that survival hurdle, which I think is required. So Axi-Pembro, Cabo-Nivo, from an efficacy perspective, look to be really good at getting in control of early disease, which generating an impressive survival advantage. Cabo-Nivo data, a couple of provocative issues in the data. Number one, a lot of patients dose reducing from 40 to 20 milligrams. And on top of that, although 70 or over 70% of patients getting grade 3 or 4 toxicity, there did appear to be a quality of life advantage associated with Cabo-Nivo, which I think many people weren't expecting because Cabo and Sunitinib probably have similar toxicity profiles, and then of course adding Nivo to that should push things down perhaps a little bit. But that wasn't the case. It was better, and whether or not that's related to the lower dose of the Cabozantinib, we don't know. Access to subsequent therapy is always relevant. 47% of patients getting access to subsequent therapy. It's not high, it's modest. We probably, as the trial progresses, I'm sure more patients will get access to subsequent therapies. So let's keep an eye on that. Overall, I think the best way of summarizing this data is to say the efficacy signal is impressive. It's as impressive, in my opinion, as Axi-Pembro. There are subtle differences in the trials, and therefore direct comparisons aren't actually that helpful. But actually, when you look and compare with drugs like Ipilimumab and Nivolumab, that combination, I think both Axi-Pembro and Cabo-Nivo are probably slightly better at getting control, overall earlier control of disease. I think in the favorable risk patients, both Cabo-Nivo and Axi-Pembro have a response and a progression-free advantage, and in the fullness of time may achieve that overall survival signal as well. So my summary of the data as it currently stands is this is another option for patients with frontline metastatic clear cell renal cancer. I think that the data supports that. I think the tolerability profile is acceptable with impressive quality of life data, and I'm looking forward to using the combination in the future.